Now we start with an update on the virus situation in China and Hong Kong. And Afifa Arifin is in Hong Kong now. Will keep us up to speed on the briefings. Afifa, let's focus on China first. What stood out for you in that briefing?
Well, the main message from the Chinese health authorities at their daily press briefing today was that prevention control of the epidemic is at a very critical stage at this point. And while the authorities have already put in place various precautionary measures ranging from extending the Chinese New Year leave to transport restrictions and locking down of cities, they say that the cooperation of the people is really the secret in fighting this outbreak. So there were a lot of questions, understandably, from members of the media asking the authorities how exactly they will deal with the large influx of people in the hundreds of millions who will be returning back to their respective cities after this Chinese New Year holiday. And the authorities did say that those who had been to Wuhan or the Hubei province should isolate themselves or quarantine themselves for a period of 14 days. But one key message that they had to talk about this is that those people, the authorities say that the enemy of this outbreak is the virus and not the people from Wuhan or who had to travel to that region. They say that isolation is really just for medical observation and in a physical sense, not an emotional sense. So the public should not ostracize those people infected with the disease and that they will be supported by the community as well. Now, the NHC also addressed concerns that some of their frontline medical staff are not trained adequately enough. They said that they have a lot of guidelines that really cover various aspects in terms of dealing with this outbreak. There are a lot of online courses as well that these medical professionals can turn to keep themselves up to speed, and that their assessment of the training situation in China and the Hubei province specifically is quite satisfactory. But in general, the message is that they have asked the public to take their own necessary precautionary measures, to report their health in a timely manner, and also to refrain from going out to public places. And if they really do need to put on a face mask. They also spoke about the widening use of IT in this outbreak and said that the public can turn to online sources to seek medical help.
Now, Afifa, what about the situation in Hong Kong? What's the latest there?
Well, currently the health authorities are still giving a briefing, but what we know so far is that there are 2 new cases of highly suspected patients who are infected with the virus. After a 2-day lull period, this brings up the number of cases in Hong Kong to 10 cases. Now, this is a couple in their 70s who were from Wuhan. They arrived in Hong Kong on the 22nd of January, but they only displayed symptoms of fever last night and were taken to the hospital. The health authorities declined to reveal the name of the hotel that the 2 patients stayed at, but did say that cleaners of the hotel, as well as those who stayed on the same floor as the couple, will be put under medical surveillance and will be quarantined. At this point in time, we do know that the Hong Kong authorities have really tightened up precautionary measures, especially at the border checkpoints, after being pressured by many members of the public here to stop services between mainland and Hong Kong. So today is the last day that the people can travel between Hong Kong and China. For example, at the West Kowloon station, which will be shut tomorrow, we do know that security measures have been stepped up. Only those with a valid ticket can enter the place, and staff have already been briefed about the necessary precautions they need to take, and trains coming in from the mainland have been disinfected as well.